Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today we're going to talk about the clock drawing test. Have you ever gone to a medical appointment and been asked to draw a clock? If you haven't, you probably will. It's part of the medical annual wellness visit that we do starting at the age of 65. Part of the test is asking you to draw a clock with the time showing 11:10. So let's talk a little bit about why that's important and why this test is so helpful to doctors and providers. We can learn a surprising amount of information about brain function from this simple drawing. This test is designed to help us screen for mild cognitive impairment, issues from strokes, and dementia. Drawing a clock sounds really easy, but it's actually pretty neurologically complex. To complete the task correctly, the brain must coordinate several different things. The patient has to understand the directions, draw the clock face, position the numbers correctly, especially the numbers 12, 3, 6, and 9. They're asked to then draw the time 11:10, and we're really looking for different sizes of the hands. The hour hand should be shorter than the minute hand, and the numbers should be evenly spaced. This means the test evaluates memory, executive function, spatial awareness, planning, sequencing, attention, and motor coordination. So that means multiple parts of the brain are being activated at the same time. There's a reason that the requested time is often 11:10. This time requires specific understanding about placement of the hands on the clock, and it's surprisingly sensitive to detect mild cognitive problems. Here are some examples of some really normal looking drawings. You can see the placement of the 12, 3, 6, and 9 are well placed, and the hands, the hour hand is shorter than the minute hand. Now this clock is a little bit abnormal, like the patient clearly understood the assignment, but the hands are incorrect and the spacing is somewhat uneven. So this could suggest mild executive dysfunction or visual spatial difficulty. On this next example, the patient starts to lose organization and the numbers drift out of position, the spacing becomes a little bit more inconsistent, and the hand placement becomes more confusing. This is a little bit more concerning because it suggests that the brain is struggling with planning and sequencing. And then this last example is a severely abnormal clock. The numbers are crowded, disorganized, or even missing, and the spatial layout really breaks down. With this drawing, I'm really a lot more concerned about cognitive impairment or dementia. Now, I do want to say that this one drawing cannot diagnose dementia. It's just a screening test. There can be lots of reasons why patients perform poorly on this particular test. You know, they can be really anxious, or they didn't go to school, or heck, who is looking at analog clocks these days? Language barrier, depression, and fatigue can also contribute to a poorly drawn clock. So that simple little clock you draw at your annual wellness visit, it's actually a window into the functioning of the brain. And we can learn a lot about brain functioning from that one simple drawing. Thanks for joining me.